anytime there's a treatment decision to be made, this is another cancer where it's a very difficult cancer with limited treatment options after it has spread beyond the liver or after there are too many spots to treat with liver-directed approaches. And so we talk with our patients about clinical trials, or we think about clinical trials anytime we're switching to chemotherapy or chemotherapy treatment that's given by mouth or by blood vessel to treat the whole body rather than just the spot treatments to the liver itself. And so in that situation, some of the challenges unique to liver cancer are back to the challenge of having, in most cases, some lack of a healthy liver in the background, meaning that the tumor, in most people with liver cancer, there are some things about the rest of the liver that may not be healthy. And when the liver function is not healthy enough, then it's not always safe to be part of a clinical trial due to the risks of an investigational or experimental drug, which might require a healthy liver to be metabolized or to prevent side effects that are dangerous to the rest of your body. And so most clinical trials for liver cancer do require very close to normal liver function, and they also require that the liver is not blocked and has normal drainage, and that can be a challenge if the cancer is out of control in some cases. Every time there's a decision point or a branch in the road, we think that's a good time to reevaluate. Is there a good new option to consider here? The most common time for people to try clinical trials is after the first line of chemo, meaning after especially for stage 4 advanced disease, we'll start with pretty standard chemotherapy, which is tried and true and has a very strong track record for success, but doesn't work forever in most people. When that chemotherapy starts to show signs that it's not working, either the cancer looks like it might be growing a little, or the tumor markers are going up a little, or people are having side effects from the chemotherapy that tell them or their doctor that may not stick with this for too long, that's when, as the oncologist, I think it's time to start especially considering what are the clinical trial options. So clinical trials are a combination of some things which are experimental, like a novel drug that's not yet FDA approved, or special tests that are only done for the research, as well as some things that we would do anyway. Standard CAT scans or blood tests are often, if they're part of standard therapy, they're considered standard of care and billed to insurance. So when somebody enrolls on a clinical trial, some things are billed to insurance if we would be doing them anyway as part of standard chemo, like the regular blood tests and the CAT scans. And then some things are paid for by the research itself, generally the novel medication that is new and we don't know for sure whether it will be FDA approved, and any special tests that wouldn't normally be done. Most insurances, if they cover medical care at the institution where you're seeing a doctor about a clinical trial, they will also cover the standard parts of being in a trial at that institution through your insurance plan. The research part should be paid for by the trial. Now, if your insurance doesn't cover medical care at the facility where you're interested in a clinical trial, that's a challenge because the standard parts of the treatment need to be covered either through insurance or by payments out of pocket, which can be prohibitively expensive. So most of the time, clinical trials are for people who have advanced or metastatic cancer after they've tried the first-line treatment. We are all trying to find new, better drugs to include earlier in the process, however. So there are some clinical trials now open that are looking at adding novel drugs during first-line treatment. So adding to our sort of our tried and true first-line chemotherapy. We're hoping that maybe if we add a targeted therapy plus chemo, that people with certain targets might have a better response or longer response or prolonged duration of response. And then there are multiple trials looking at people after surgery to see if adding chemo after surgery can help reduce the risk of recurrence.